I'm Wagstaff. I'm a nurse practitioner with Elite Medical and Aesthetics in Lone Tree, Colorado. And today I want to talk a little bit about the differences of when you might think about Botox or botulinum toxin injections versus dermal filler. So this is something a lot of people get confused about, and often will come in for an appointment booking one and we'll have a conversation and will realize that they might want to do the other one, or maybe they need to do nothing at all. The most common areas for botulinum toxin injections are going to be the glabellar frown lines, that's between the brows. I am treated right now, so I cannot fully activate those muscles, but they're responsible for the scowling between. The next most common area is probably the forehead. I am about 2 months in, so I'm starting to wear off there, have a bit of movement, but not ready to retreat yet. And then also the crow's feet. And so this lasts the least amount of time, so mine has been gone for about a month there. Those are the most common areas. You can also do bunny lines, these guys. DAOs, you can do neck bands. That's actually these little bruises I have on my neck are from doing neck bands recently. And there are a few other off-label areas you can treat. A common area that people will want me to treat with Botox or botulinum toxins, so basically Botoxium and Dysport-Jeuveau, all different types of botulinum toxins. That's for another video. But a lot of people will come in and say, hey, I have really bad smile lines here. I'd like some Botox. Sometimes they'll even say their last injector did it. And we have to be really careful because there's muscles all over the face that control our smile, control our expression, and if you hit the wrong areas, they can actually make the face look really distorted. How botulinum toxins work is that they stop the muscle from creating actions that lead to lines and wrinkles. So when I raise my brows over and over and over, if I do that a lot, I will get lines on my forehead. Easy to treat because that muscle is only responsible for my brows. However, the muscles around here control my mouth. And if I hit here, what actually might happen is it drops my lip, making it look like my philtrum column, or the distance between my nose and my lip is longer, which could make me look like I have ducky lips. So we don't want to do that. We also have to be careful on the cheeks here, which a lot of people want to treat lines across their cheeks. And if you hit those connect to the corner of the mouth and can actually make it to where you can't smile on one side. So when you're smiling, you might be doing something like that. And nobody wants to look as if they'd have Bell's palsy or a stroke. And that's what can happen if something's mistreated. So typically think botulinum toxins treat muscles that lead to wrinkles. If you have a deep line or fold that needs to be filled, that's filler. But you can only do filler in certain areas of the face as well. So for instance, if you have deep lines on your forehead, that's not really an area that's commonly treated with filler, or if it is, it's very dangerous, and so that needs to be a conversation. But a nasolabial fold, a cheek, jawline, lips, under eyes, temples, there's a lot of areas that you can treat for filler. If you're not sure, just go have a conversation. A lot of places like us will do free consults so that we can just chat. And my main goal there is just to give as much information as possible so that you can make an informed decision for yourself. So we talk about goals together, we talk about what things might look like, we talk about how much they cost, and then we can come up with a plan together. And so if you're in this area, absolutely come see us. If you're not, then definitely look for medical professionals in your area that are willing to take the time and chat with you about different options between Botox and filler.